And one day the commanding officer comes in and says, Voit, I want you to check this guy out. And I go in, and in the chair is Richard Nixon. Now, mind you,
That's incredible.
I was 26 years old. I never saw a president live, let alone looking down somebody's mouth.
You think he could have warned you? All dentists know the common career paths. But how do you know which path is right for you, and are there other options out there?
On this podcast, we will be chatting with industry experts. We want to bring you the knowledge and resources you need to take your career to the next level and break down those industry secrets interview by interview.
We are here to ignite a revolution in the dental landscape
and help you, the dentist, build the career you have always wanted.
I'm Dr. Cassidy Reeder.
I'm Carter Frank.
And welcome to the Revolution Dentistry Podcast.
Welcome to the Revolution Dentistry Podcast, everybody. I have my good friend here, Dr. Cassidy Reeder, as well as a very special guest, Dr. Kerry Voigt. Welcome to the podcast, Dr. Kerry.
Thank you. Excited to talk about it.
Yes. Dr. Kerry Voigt is a legend in the dental industry, especially in the prosthodontic specialty. He's a prosthodontist with more career experience than 99.9% of dentists in the industry. Dr. Voigt has over 40 years of experience in private practice. He's had leadership roles as clinical director at ClearChoice and Eon Dental Implant Centers. He's been a key thought leader on the all-on-4 immediate load full arch treatment concept. He's conducted over 8,000 all-on-4 consultations and has performed over 5,000 all-on-4 upper and lower arches himself. Dr. Voigt has also served as Lieutenant Commander in the U.S. Naval Dental Corps, as Director of Prosthodontics at Camp Pendleton, USMC, and has provided prosthetic reconstructive treatment for President Richard Nixon prior to the Frost interview. Dr. Voigt has also served as Clinical and Laboratory Director of Fixed Partial Prosthodontics at the University of Illinois College of Dentistry. Dr. Voigt has conducted numerous presentations and courses on implants and implant-related restorative dentistry for Noble BioCare, BioHorizons, the Pecos Institute, American College of Prosthodontics, American Academy of Maxillofacial Surgeons. I don't know if I'm saying that right. That's a mouthful, but very impressive.
It's a mouthful.
The American Academy of Osseointegration and the Seattle Study Club. That is quite an impressive resume, Dr. Kerry.
Yeah, it's very impressive. And it's a mouthful. We're so grateful you're here, Dr. Kerry Voigt. And, your expertise speaks for itself. We can tell that you just got, done with the procedure. Hopefully it went well. I love the loops that you get, the light that you have. So moving forward and asking a little bit about yourself, tell us a little bit about your journey and what brought you into the dental field. What inspired you to be a prosthodontist?
Quite a story. My father was a tool and die. We had a machine shop in our house. I grew up with bandsaws, lathes, drill presses. We could make anything. When I was in high school, I was going to go into engineering or architecture, something along those lines, and I took biology. And I'm like, wow, pretty cool. So went to the guidance counselor. Said, hey, Kerry, why don't you go see a dentist? Well, nothing hurts. What do you? He says, go see what the dentist. So I go to my local family dentist and I'm watching what he's doing. And I'm going, you know what? This guy's engineering. It's biology. It's people. I said, that's it. I got focused, and I had to laugh because in the high school I had scholarships for athletics. And I said, nope. I'm focused on dentistry. I got through college, undergrad at Loyola University, 2 years, day school, night school, summer school. Got into dental school, had my dental degree when I was 23, and went into specialty, fixed periodontal prosthetics, which is a combination of periodontal surgery and prosthetics. And I had a specialty degree by the time I was 25. So my journey has been unusual. But I was focused and I'm passionate about it. And one thing that I have to laugh about is I have 4 beautiful daughters, and they're like, Dad, why are you still working? I said, because I love what I do. I don't have to work, but the changes we see with this procedure are so dramatic that I just want to keep doing it, and I want to share that experience with a lot of other dentists who are interested in it but may not feel comfortable with it. So that's where we're at.
Awesome. Very cool. So, to dig in more on that, you have extensive experience with the on for treatment concept. We're pretty familiar, and you just sort of talked about the incredible benefits it provides patients. But from a practice owner standpoint, what can you tell us regarding the value of providing full arch implants services in a private practice?
That's that's the key question right there. Dentists in general want to help their patients, and we all do. And we learn new techniques. And some of the techniques are pretty easy to learn, some of them aren't. For example, dentists are always looking for new sources of revenue: Invisalign, porcelain laminate veneers, bleaching, sleep apnea. They're all fields that we can really help our patients with. When it comes to the all on four full arch procedure, I have witnessed from the very ground level when it in 2006 when I was approached by Clear Choice. We went to Portugal, studied with Dr. Malo, who invented the procedure. And with my background in surgery and my background in prosthetics, I'm watching Dr. Malo do this procedure. And I'm not bashful. I said, Dr. Malo, you can't do that. And he looked at me and said, Dr. Voigt, the world is not flat. Progress is inevitable. Learning is optional. That stuck in my mind. And when I saw the patients that he treated, a lot of them were pretty slam dunks, but changed some of the other ones that had really complicated issues. We were able to provide solutions for that. And that's very exciting. That's very exciting. And so I've had the opportunity of being the second prosthodontist in Clear Choice. They advertise all the surgeries done by maxillofacial surgeons and prosthodontists. So I couldn't do surgery then, but I observed every surgery. And the thing is, we had maxillofacial surgeons come in. They'd spend they are good surgeons, and I realized they don't know anything about what we need prosthetically. So I had to figure out a way, non offensively, to talk to a surgeon and say, I want to help you so I get what I get. So literally, I would tell them, I said, you're like a pilot. You know how to fly, but you've never flown to this destination. I'm going to be your navigator. I will show you what you need to do so I get what I need to have the patients prosthetically be satisfied and delighted. That is the key. And like anything else, think about it when you have a computer problem and you call it in, and the guy's going, "What's your problem?" He goes, "Oops, I need somebody else. I got to go up one level." So he goes up one level. He's talking to, "Oh, I got to go up another level," depending upon the situation. And what that translates in dentistry is case selection, figuring out which is the level 1, level 2, and level 3, so that you don't bite off more than you can chew. No pun intended, right?
Exactly. Yeah.
And so
Exactly.
that's where most of the people that get involved in this don't understand what they need to know so that they can have a basic level of case treatment, so they don't run into problems that would make them wish they would never want to do it again. And I've seen that over and over. That's what you don't want. And not only that, when you take courses and somebody's over your back and you're working on a patient and doing stuff, it's that you've got the confidence and the security of having them step in case you run into a problem. When you're on your own, you don't have that. And it's kind of interesting because nowadays, what we can actually do, and I've done this with some of the different centers I've been with, in the middle of surgery, they'll call me up and say, "Oh my gosh, we've got this issue. How can we handle it?" We do a FaceTime. I see what's going on, and I give live. I said, okay, this A, B, stitch, boom, 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 boom. So there's certain sequences so that if you run into some problems, you've got plan B and C. That's the key. And that's not really taught in a lot of places. And it could be a better job can be done. And that's one of the reasons I want to get involved, to share with general dentists, because general dentists can do this. You just have to have the right situation so you don't get into trouble.
Yeah, Dr. Voigt, that you bring up an incredible point there, that general dentists, there is an opportunity for general dentists to be doing all on X procedures. And what can you tell us about the importance of mentorship? And we know that you have been an incredible mentor to so many dentists throughout your career, especially for this kind of procedure. So what can you tell us about the importance of mentorship for a general dentist who's trying to learn how to do this kind of procedure in their practice?
Well, like I said, there's a lot of courses that are given that give you some basic information, but there's nothing like actually having someone that's available either next to you while you're doing it and saying, okay, see what's going on here. This is what you can do there. Because once you have that confidence, it's no different. I mean, a lot of the things that we as general dentists or restorative dentists do are way more complicated than surgery, believe it or not. You just need to know, if this happens, what do you do? If this happens, what do you do? What are the little potholes? There's no reason for people to hit those potholes again. And the mentoring with that, whether they're watching somebody who's experienced doing it or they're doing it with the guidance of someone. And once they get that confidence, it can be a very, very profitable procedure in your office, because most of the cases that come in are people that are in your practice, that trust you, that trust your hygienist. And if you can show your staff and obviously believe it in yourself, what you can do for people, it's an incredible service. And the enthusiasm I've seen in general dentist office that have implemented has been, I'm going to say, contagious. It's actually contagious. Before you know it, you got people who have one tooth, a person with one tooth, and they want all their teeth pulled out. I go, whoa, 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 slow down, slow down. We can fix this another way. And so that's important. The other thing is if you have a patient that you see is a candidate, our job is to let them know what all the options are. It's their choice to do what they want. And so many people come in and they said they need, if you need 4 more implants, 3 or more implants, or you're missing a bunch of teeth, you just kind of say, you know what? You need to know about this other option. You don't have to do it, but you need to know it. And the state of the art with this right now is such that I can comfortably say, other than what we did with the analog system traditionally, the digital system is, and the materials and surgical techniques have improved so much. There's no reason that these restorations can last a lifetime. And as far as revenue, okay, everybody has a hygiene program, and they get pretty good revenue from that hygiene. The same thing is with these implant-supported, screw-retained, all-on-4 prostheses. Taking them off, checking it, going back on, it is a source of income. And the thing is that once you get some of these people involved in this, they spread the word. People are worried about marketing. The best marketing in the world is satisfied patients. And with the system, if you can bring patients to a facility and code treat them, whatever you want to call it, and then start doing it yourself, they are going to tell other people in their practice. And that is, that snowballs. And it increases the value of your practice too.
Yeah.
Yeah,
And that
absolutely.
and that makes me curious. When you're mentoring a GP, are there any characteristic traits that you notice that make you think, yeah, this guy's going to thrive in the implant industry? Or is there anything that sort of turns you off and says, maybe this guy won't do so well with implants?
Well, part of my experience has been with a dental implant center of vetting people. And so I would have 3 or 4 dentists from around the country come to my office and watch the procedure start to finish, having their staff talk to my staff about how do you present this, looking what the assistants are doing, seeing how the 3D printing is done. Once your staff starts to see that, everything falls into place. Now, that's watching. What about, can they do it? That's the question. And so, depending upon their experience with implants, and it may be from nothing to guys doing some of the procedures already, it depends on the person as far as to answer your question. So, the thing is, I would then go to their office where they're doing the procedure and watch them and talk to them. And, our patients are sedated. I think probably more than 95% of the people that do this have sedated patients, so you can talk freely in front of a patient and discuss what's going on. Then you see if it makes sense. Now, the other thing is that the investment in equipment digitally. Now, a lot of us have intraoral scanners, but when it comes to photogrammetry, there are different ways of doing that, and that is an investment, and that's a whole nother discussion as to whether it's a good return on your investment. But again, the advantage that a general dentist has is he's got patients who trust him, and that is huge. That is huge. You don't have to go out and spend tons of money trying to compete with everybody. You've got the people right in your practice. It's just being able to identify them and have a technique to discuss it with them as an option. I can't tell you, and this is a funny story, where a dentist would look, I would go and check a person after a hygiene appointment and say, there's a little fracture in this tooth. We're going to keep an eye on it. Next time they come in, there's a little stain. It's already separating. And I said, well, we might try bonding, all the different things. And then all of a sudden you go in one day and he goes, I want the crown. I'm like, what happened? So my hygienist told me I need the crown. So the hygienist told them, they believe the hygienist. That's the kind of relationship that the hygienists have with their patients, because, they're with them and they get to chat instead of just,
Yeah.
The general dentist has tremendous opportunity for additional revenue if they're so inclined to do it. And you don't have to get really complicated cases. How many people have denture patients? Denture patients or partials, things like that, where you can say, you know what? You've spent your whole life sacrificing, paying for your kids. It's your turn now.
Yeah, and that's a good point.
And the verbiage, the approach is so important.
Yeah.
I actually had a quick question, and Carter, if that's okay.
Yeah,
go
ahead.
You mentioned the importance of, mentorship in the, all on X industry for general dentists, if they're interested in this kind of procedure, to, seek out someone who's able to help train them and help them get comfortable with the treatment. So what have you noticed? What do you feel like the opportunity that general dentists have, especially like going into the future? Do you feel like there's a trend in the all on X industry right now that is giving general dentists more of an opportunity than ever before to get into this procedure? And can you tell us a little bit about that you've noticed?
So, old dogs are hard to learn new tricks. The young students coming out of dental school now have been exposed to digital technology. The older folks, they're afraid of it. They don't want to take any chances. The younger people in general, the young graduates, they're ballsy, to put it mildly. You just have to make sure that you don't bite too much off. And that's the
right
venture. I love the attitude. I mean, before, when I went to school, you bow down, and now their students are challenging professors. And I love it. It's a great environment. And this, brain surgery is easy if you know what to do. All you need to do is know what to do. If once you know these things, and not only that, if you have the opportunity to just say, hey, wait a minute, and contact somebody, even a FaceTime, boom, and then to know the strategies, and that takes time. I have dentists that come to my office on their day off to learn and to see, and I do mentoring for them, and they get comfortable, they see things, they ask questions. It takes time to learn something. You don't, like I said, you don't want to get into trouble, but once you know what to watch for, what to look for, how to approach it, it's very, very doable. I'm very excited for people involved.
Yeah, thank you for answering that. And I wanted to follow up with another question then. So do you feel like the technology going on right now in the in implant world, especially all on X, do you feel like the advancements in technology are making it a little bit of a simpler procedure at all, or do you feel like there are any advancements that are helping not only the patient maybe have a quicker healing time or a better experience overall. But do you feel like there's advancements in the industry as far as technology goes that's helping dentists learn a little bit more efficiently or learn a little bit better how to do this type of procedure? Like, I feel like I've seen some types of, implant systems out there that are a lot more, I guess, user friendly. And so they're able, and so general dentists like myself, were able to, hopefully learn the procedure with not as much of a learning curve, if you will. But tell me, have you noticed anything like that going on?
Well, when you're talking about, yeah, to answer your question, yes, dramatically so. The implant companies in any industry in general, when they see there's money to be made, they throw money into research. And the big thing with the all-on-X procedure is immediate load, immediate function. Mm-hmm. And in order to have that, you have to have what's called insertion torque. You know that. Yeah. You can't have an implant wobbling around. With photogrammetry, you can't have an implant wobbling around. I mean, if you covered it up and let it go, it'd heal. But people want teeth. And so, yes, the technology has been tremendously improved. The implants have been improved. But like anything else, you need to have your bag of tricks. If this happens, what do you do? If this happens, what do you do? When I was with Clear Choice and then Eon, and I watched a lot of these surgeries, the surgeons would come in. They'd take about 3 months. They'd work there, the maxillofacial surgeons. They figured they knew what to do. They'd go back to their practice. I'd get a new one in. So I have actually mentored over 60 maxillofacial surgeons, mind you.
Wow.
Maxillofacial surgeons that are asking me, they're like, oh, you can do that? Here's a guy, somebody goes through the windshield of their car and they put them back together. And when it comes to certain implants, they're like, oh, I didn't know you could do that. But once you know, you know. And that's the beauty of mentoring, right on the spot. I used to have a mentoring service where I would take my staff and I would go to different offices around the country. And I would treatment plan the case online with the maxillofacial surgeon, go there. I would actually assist the surgeon and tell them this is what we're doing, why prosthetically. Prosthetically driven couldn't be more important and accurate in implant dentistry with one, but when you're doing a full arch, to understand, visualize, where are we going? What are we trying to accomplish and what's necessary? Because slight changes in the position of an implant can be pretty significant to a patient. Now, everybody's got this guided surgery stuff now, right? There's guided surgery for all-on-X.
Right.
And that's actually more complicated than doing it freehand. But you've got to know how to do it in order. It's kind of like the implant companies were trying to make it simpler. And because it then becomes more expensive, and if it doesn't work out, now what do you do? So those are the bailout strategies. And the best way to go through that is by seeing it done and by going through cases. In postgraduate school, I don't know how it is with every company, but you'd have endodontists, prosthodontists, periodontists, oral surgeons, orthodontists, all look at a case, mounted, photographs, get together, everybody'd make a treatment plan, and then there'd be 20 different treatment plans, right? And then you say, well, what's the benefit here? Oh, I didn't think about that. This guy doesn't know this. Now, knowing surgery and knowing prosthetics really gave me a great background. And because of my background with my father of building, I've actually designed surgical instruments that my father was able to make. We made surgical instruments to suit certain.
Wow.
Yeah.
And just to go back on a point you made a little bit ago, you said that the best kind of marketing is client satisfaction. And I totally agree with that. If you want your patients to be loyal to you, you must be loyal to your patients. And you do a very good job at that. I don't know if we can edit it into the video of your pre-surgery and post-surgery operation, but it's phenomenal work. And it's very impressive.
This morning I did a consultation on a fellow, a denture and a couple lower anterior teeth. And there were certain techniques that we use radiographically, so on the CAT scan we can see where the teeth are on his denture. Otherwise, most of the time you see just no teeth because it doesn't show up radiographically. So there's these little tricks on getting that information and then showing people examples. And over the years, I have addressed all the concerns that people have asked me and that said, I should have said this, I should have said that. And you just be honest with people. Honesty is the best policy. They can't believe it. And you say, you know what? You don't have to do this. You don't have to do this, but it's a nice option. And they, well, I want to save my teeth. That's great. Let's save them. And then all of a sudden, well, you're going to have to take this out, that out. We're going to have to do a socket preservation. We're going to have to do a couple surgeries. And, it's going to be this much time. Usually it's between 5,000, 5,500 for a single implant. And they need 4. And then we say, okay, we got these 4 in. We saved your real teeth. What color do we make these new implant crowns? Well, I don't like the color of my other teeth. Oh, well, we're going to have to do some laminates. Oh, no, it has to be a crown. Oh, you might have to add endo and perio surgery. And all of a sudden, it's like, you're like,
right.
And I don't know how long, and I don't know, I can't tell you how long it'll last. Oh, my God. And so for years, I did 100% reconstructive with telescopic copings and all this and that. And in spite of that, I couldn't let them know they'd get decay. Implants don't decay. All they have to do is a very simple hygiene procedure and have it checked periodically because you can't see everything. We put in these big bridges. We have no idea what's going on. We can't take it off. We can't see it on teeth. This is like the cat's meow. It's the best of all worlds. But we're running a business. And a lot of dentists that are doing the All-on-X never take these off. Why? They lose money. Well, how long does it take to unscrew it, to check things, put it back on? You don't have to be a hygienist to do that. You can take it off. So then figure out your costs. What do you charge the patient? And nowadays, the ADA has codes for implant maintenance on screw-retained implant-supported bridges. Now, policies cover things differently, but you can get a pre-treatment estimate. You can get these things. I have in my current office, it's been 3 years on the 18th of this month. That was my 3-year anniversary. We've done over 1,000 of these already. And the number of, I'm going to need like in Jaws, I think we're going to need a bigger boat because of all the implant maintenance. And here, I'm in our consultation room is glass, and when I'm doing a consult and a person's walking by who just had it, they'll poke their head in and say, I sat there, do it. You think it's going to hurt?
That's awesome.
It's going to be this much. You expect that much. And I go, okay, I owe you a beer. And then everybody laughs, right? But when patients have this done, they can't keep their mouth shut. They will talk about it. And that's, like I said, contagious in a good way for a practice.
Right. Thank you, Dr. Voigt. And I guess following up with that, you have, like you said, 8,000 consultations under your belt, and so much experience in helping patients make that decision to take that step. So, what would you say is the biggest strategy or the most effective strategies? 1 or 2, maybe you can come up with an example of a situation you had where you helped a patient make that step and make that choice. What would you say are some strategies that you found super helpful in helping helping that patient make that step?
Well, the first step is the consultant. She listens to what their concerns are. People want to be heard, and it takes time. And it's important to ask the right questions to find out what their goals are. That's number 1. Number 2, see if you being me, could realistically provide that. And it's all about managing expectations. Managing expectations. What can you do and what can't you do? And people are concerned. I see people who are radio broadcasters. Really high profile, they want to know, high profile people, they want to know how they're going to talk. And I said, guess what? And I hold up a denture and I said, guess what? I've done thousands of these. I don't know how people learn to talk. And then I hold this up and I go, I know you'll be able to talk. And with digital technology now, because we can superimpose where they were when they started with our provisional restorations, with the design, It's not even guessing anymore. You can just go, but. They go, but I feel differently. And here's a little story. I'll share this. When I was on active duty at the Marine base, I took care of a lot of Vietnam vets that got banged up pretty bad. And I had one pilot who had his arm shot off, and he had pain in a hand that didn't exist. Now, I wasn't going to argue with him, but it's not real. And what do I mean by that? And as a dentist, I'm sure you've put in restorations and they go, it's hitting here, and it's really hitting in a different.
Right.
So you can show them what's real and tell them this is going to happen. That is going to happen. You may have this. If you do, you know about it. Guess what? That'll go away. You've been missing teeth for a long time in the back. Look at your tongue. It expands. We put teeth back there. You're going to bite yourself. You're going to say, move the teeth. It's not the teeth. It's the tongue. When you speak from a position of experience and show them examples, all of a sudden their fears. And at the end, you say, you know what? And you don't have to do it. All these people, when they hear about all the other things to look good and you don't know how long it's going to last, they go, well, how much was that other thing? And they usually say, instead of all on four, they say the four on all, or, they mess up the thing. And I'm like, oh my God. But it's pretty funny because
Right.
it sells itself. And then the before and after pictures and testimonials of happy people, for the most part, one of the biggest concerns I have is about smoking because of healing afterwards. Implant failures, there's some statistics on that, but, and you've got to be honest with people. I've gotten to the point where people lie, and so we actually will do nicotine tests to make sure that a person is okay so that we don't have complications later on. And I just tell them, be honest with them. Here's what's going to happen.
Yeah. And when you're starting a new thing, especially something as complicated as implant dentistry can be, it's very common to make mistakes at first. But it's important for the doctor to know that, hey, it's okay to do that at first. So what other advice would you give to a young dentist who is interested in pursuing a career in prosthodontic and implants?
Well, in the All on X, when a pilot goes to fly a plane, he's got a checklist. Check, 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 check. And you form a checklist of what things you need to cover, especially in the consultation, so that you've talked it. And then afterwards, you have the consultant actually talk to them and say, did you understand this? This is what this means. And they initial it. They initial things, saying, yes, I understand. If I do this, I do that. And you really can't use that to enforce things, but it reminds them that it was discussed. Because you don't want to get into something where you say, you didn't tell me this. I didn't know this. If I would have known this, I would have done it. Oh my God, if I would have known this, I never would have done it. Those are the things I hear. I'm unfortunately or unfortunately known as Dr. MacGyver for All on X. When guys screw it
That's
up,
very fortunate.
yeah, with good intentions, don't get me wrong. And they finally go, I don't know what to do anymore. Who do you call? Ghostbusters, Voit. Hey, they call me up. Okay, let's take a look. Bum, bum, bum. I don't trash other people. I said, dentists, and this is my observation after teaching, mentoring, doing this, dentists do the best job they can based with their skill and knowledge. It would be as if it was their own family member in the chair. So, wait, a family member they like, let's put it that way, in the chair.
Right. Yeah.
Right? And so that kind of honesty and that kind of enthusiasm to do what's the best is important. How you do that, that's all the little devil in the details. And that's where the mentoring comes in. And knowing that you have the security of either bringing a patient to a facility or in some cases go to their facility and do a procedure, which makes it more expensive, but you try to keep costs down. And there's some very exciting new things in coming as far as dental materials to where we're going to get, it used to cost $60,000 upper lower. Now, and that was a fair price because you knew it was going to take how many appointments, whatever, denture teeth, bar, this, that, it's going to wear out. You're going to have to replace it, all that stuff. And so that was expensive. It was a fair price. Now we can go under 40 for a double arch. And I mean, I see the day coming in the near future where we're going to be able to do this for $10,000 an arch.
That's incredible. And you know what? I think that would be
you
great.
know how many people are available? And if you don't do it, they'll go to the guy next door that is doing it. So you don't want to miss the boat on that one.
That's true. And Dr. Voigt, that leads me to another question that I wanted to ask. You've had so much experience, so much success in, being able to provide this treatment to thousands of patients. And, you've got practice ownership experience as well. So what's been helpful for you in terms of bringing these patients in? Because, like you mentioned, it's an expensive, treatment plan. And what's been helpful for you in targeting the proper, patient demographic, and not only, finding the proper patient demographic for this type of procedure, but helping them, accept the treatment. And you already went into that. So I guess my main question would be, how is it that you, over the course of these decades, how is it that you've had so much success in finding so many patients? Because a lot of practices, they struggle. It could be, maybe marketing, maybe you have more, insight on that. But what's been your experience with finding all these patients?
Again, everybody's marketing. There's different strategies. There's all this. The patients are already in your practice. So the marketing is identifying the people in your practice, which you can have staff members do, locating. So when they come in for their recall, checking things and saying, oh, by the way, that's what we used to do when all of a sudden the hygienist knew we had porcelain laminate veneers. All of a sudden, oh my God, you don't have to have a crown. You don't have to have this. And, you plant the seeds. That's the internal marketing. Or the person who has a reconstruction that's de-cemented, or a 6-unit bridge that's de-cemented. Partial dentures that break, full dentures. That's the biggest. I don't even know what the current statistic is. There were only over 30 million people. I'm sure there's more without teeth in this country that are dental cripples. And some of them have gone to see oral surgeons or surgeons that do it and told them they had to have extensive grafting, multiple procedures. You don't need to do that anymore. With our zygomatic implants now, we're actually able to take care of people who have no bone. And pterygoid implants, that's advanced. That's like tier 4 on the computer repair guy. But, which patients are where? And that's very teachable. It's not rocket science. I could show you a photograph, a classic one, of a case that was done elsewhere. And when the guy smiles, you see like 3 millimeters above the edge of the bridge. And
oh my gosh.
I said, so the first thing you have to do is, how high can you raise your lip? Why? I don't like my teeth. I don't care. But when you like them, you're going to smile. You don't want to have to go through this again. That sounds silly, but it's not, because then you can plan your case to see if it's doable. That's just one of it. The gummy smile. What do you do with a gummy smile? Can it be treated? It can be treated to where patients can't. How did you do that? I said, I'm good. I'm not God, but I've got a magic wand here. I can help you out. But it's that identification of a couple factors. Another thing, I'll just give you a little tidbit here. We record people for the initial exam. We record them talking. 1 to 10, 50 to 60, 60 to 70. Susan sells seashells at the seashore. Why? Because later, when they say, I sound different, and we record them again, and you play the recordings, they can't tell which is which.
Mm-hmm.
Indisputable. But I sound different myself.
Right.
Yeah, the guy's got pain in a hand that doesn't exist. You sound different because you hear yourself. But the reality is everybody else doesn't. So that's just
right.
pearl right there.
Yeah.
That's awesome. And, I feel like, this interview has been incredible. Thank you so much again. You
I love
have
it.
helped us understand the importance of mentorship. Finding not only just taking the courses, right? Not only just taking the courses that help teach you, but also finding someone like yourself who's had so much experience in the all-on-4 implant world, and being able to call someone up or FaceTime someone in a situation and be like, what do I do here? Or being able to go to another dentist's practice and observe their cases, or maybe having that dentist come to your practice and have them observe cases that you're doing and support you in cases that they're doing at their practice. So that value of mentorship is so incredible. And, you gave us great information on the value of all-on-4 in a practice, from a patient standpoint, from a revenue standpoint. You've shown us that, the all-on-4 industry is growing and is only projected to grow further and further. And the opportunity for general dentists to learn this procedure is more present than ever before. And
Absolutely.
yeah, and the technology that's coming out is making it more affordable for people, is making it so that dentists, don't have as intensive a learning curve at times for certain procedures. And you showed us some great strategies for helping patients accept a treatment plan and reaching from your internal patient pool from your own general dentistry practice or whatever practice you're in to help people find this opportunity for All on X, and providing this opportunity for your patients that you're caring for, instead of having to refer that out and losing out on all that revenue, and also giving the patients a dentist that they trust, right? It's incredibly valuable. And, just... I just got to ask this question. I know that we're running out on time, so just maybe a couple of minutes. But Carter mentioned that you treated President Richard Nixon at one point. That's incredible. So what was that situation like? What got you into that position?
Well, when I started dental school, knowing I was going to be really young, I looked like I was 12 years old. So I voluntarily enlisted into the Navy, so I could go in and get some, yardage. And I didn't know I was going to get interested in specialty training, and I was fortunate enough to get accepted. So here I was at Camp Pendleton. We had 35,000 Marines, 1st and 3rd Marine Division, 114 dentists, 13 dental clinics. Huge, 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 huge. I was with all the specialists, and we would have an operatory, and then on either side we'd have a general dentist that would be doing rotating so that they could do. We had fixed, removable, maxillofacial prosthodontists, endodontists, periodontists. We had the whole slew. So we had a lot of general dentists in the office, and so everybody wants to do crown and bridge. And in the military, it's tough to get crown and bridge done unless you're a lifetime, you've committed to the service for a long time. And so I was doing all the crown and bridge for a lot of admirals and generals and all these people. And one day the commanding officer comes in and says, Voit, I want you to check this guy out. And I go in the chair is Richard Nixon. Now, mind
That's incredible.
I was 26 years old. I never saw President live, let alone looking down somebody's mouth.
You think he could have warned you?
Oh, no. Oh, no. That'd be too civilized. So
that's so funny.
The president goes, oh my God, he's awful young. And so the commanding officer's rattling off blah, 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 blah. And then Nixon goes, we have to have confidence in our youth. And so that was cool.
That's incredible.
I ended up seeing him. I had 2 Secret Servicemen right outside the door. I had an ambulance right outside in case anything was...
An ambulance? Oh, no.
Actually, the president, it was never made public, and I'm not in a position to say it, but a lot of these presidents aren't really healthy, and the public never knows that. And so, as a precaution, they have, in the unlikely event of a water landing, your cushion is a flotation device.
Yeah, right. Yeah.
So one day, my wife was was a hygienist, and she was learning how to play golf, and she came. We were going to go to lunch at the officers club, and Nixon was there. He said, "Oh, do you play golf?" She goes, "Yeah." So he says, "Well, would you join us?" So she played golf with a 3-star commanding general, President Nixon, his personal aide. She was the fourth.
Wow.
And the first time she broke her scorecard was a test. Richard Nixon, eyes, da 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 da. I mean, it was quite an
That's quite the souvenir.
Yeah. So my message to dentists that are interested is, no matter how little you know or how much you know, there's nothing like experience, and it's learnable. Understand what the limitations are so that you don't get into trouble. And the rest is, I mean, pretty simple. Yeah.
Yeah.
And it's profitable.
Yeah, I think that's...
And it's very rewarding. That's the best word. I mean, some of the testimonials, you can't believe it. And if you have a minute, I used to get my hair cut here in the local place, and a gal rented a chair. And finally, she kept moving and moving, and she was too far away. And I get a text from her saying, "I'm in the emergency room at so-and-so in the hospital." And I go, "Oh, my God." Now, I'm going to back that up. I tell patients, I said it a couple times, I'm good, I'm not God, right? So she said, "I'm in the emergency room, I'm okay. This woman here," and I really couldn't see on the photo real good. I just told her, "You've got the most beautiful teeth in the world." And she goes, "Yep, I'm very lucky. God gave them to me. And his name is Dr. Voit." Every time I say that, I get, look, the hair in my arm, stands up. And I saw that lady, the nurse, the emergency room nurse, about 4 weeks later. I didn't recognize her. She said, "I can smile. I lost 30 pounds. I'm dating again. You have changed my life so dramatically." And anybody who does this procedure has those stories to tell. But, instead of doing it's nice to do crowns and fillings and stuff. But when you can change somebody's life like that, it's, wow. No other profession can do that. Not with as little trauma and for the expense. We're very, very blessed.
Absolutely. Absolutely.
So what else, guys?
Well, Dr. Kerry, it was very, very great having you on here. It was a very informative time. I'm sure we all learned something. So we're looking forward. Maybe we'll have you on again. This was very fun. It would be great to get you back on for more stories later. Cassidy, do you have anything to
Yeah.
close off
So
with?
absolutely, Dr. Voigt, thank you so much for hopping on with us. If a dentist wanted to maybe shoot you a question, or ask for some advice, or maybe seek a little bit of mentorship even, would there be like an email or some form of way to contact you so that they could ask a couple questions and maybe pick your brain?
Well, what you're saying is what's the next step, essentially. And so to get random questions without knowing the background is pretty difficult. There is a group now that is being formed that has been working with a lot of general dentists, and now they're expanding it to say what offices are interested in getting involved in All on X. And that is why we're talking. One of the reasons is that there's an opportunity for dentists to get involved with that. And it's called Jet Set. And
Okay, awesome.
set up
It's like a mentorship kind of program?
it's a mentorship program where offices then become affiliated with a person like myself that can act as the mentor and help them get this implemented into their practice. And that is the least traumatic way of doing it.
Right.
Instead of hopefully figure it out. Because when you start to figure it out, it's not easy. Most of the assistants and hygienists know the doctor will go to some meeting, he gets all excited about it, and 3 weeks later, nobody's talking about it because there's no follow-up, there's no continuation. Well, that's what this program is going to be about. And I'm
Awesome.
very excited.
Yeah, awesome. Well, thanks so much for letting us know about that. And,
Okay.
thank you for taking the time to explain, your situation, your history, and, what you got going on right now. I'm sure a lot of dentists would love to, have you as a mentor, considering the vast amount of experience that you have in the industry. And, thank you for disclosing and for sharing with us a little bit about what you're looking forward to in terms of the trends that are offering opportunities for general dentists like myself to get into all on 4, all on X. But with that, we'll go ahead and let you go. We'll make it a wrap.
Okay.
Yeah, thank you so much. And we'd love to have you on another occasion possibly. And we'll be in touch.
Sounds good. Look forward to it. Thanks,
Thank
guys.
you, everyone.
Thank you, Dr. Voigt.
You have a good day.